Welcome to today's video on chest tube management. In this session, we will cover essential tips and actionable interventions for caring for patients with chest tube, whether you are a new nurse or just looking to refresh your knowledge. This video will equip you with the critical skills needed to manage chest tube effectively and safely. Let's dive in. Tip number 1, follow VAPA. Always start with VAPA. Wash your hands, introduce yourself, identify the patient with two identifiers. Check for allergies, explain the plan of care, and assess the patient. This ensures safe and effective care. Tip number 2, monitor closely after insertion. Check vital signs, oxygen saturation, breathing sounds, and the insertion site every 15 minutes for the first 2 hours, and then after first 2 hours at least every shift. Check all these things. Number 3, keep an occlusive dressing at the bedside. In chest tube management, preparedness is crucial. Always ensure that an occlusive dressing such as sterile gauze or 4x4 or petroleum gauze is readily available at the patient's bedside. This dressing is vital in the case that the chest tube becomes dislodged. An occlusive dressing can quickly seal the insertion site, preventing air from entering the pleural space, which could lead a life-threatening condition known as tension pneumothorax. Having the right supplies within arm's reach allows for immediate actions, ensuring patient safety in the event of an emergency. Remember, in chest tube care, being proactive can make all the difference. Tip number 5, evaluate for respiratory distress. Regularly check for increased respiratory distress or chest pain or any changes in breathing sound or oxygen saturation. These signs can indicate complications with the chest tube or lung function. Act quickly if any issue arises to ensure patient safety. Tip number 6, manage chest tube dressing and drainage. Ensure the chest tube dressing is always dry and it must be always secured. If the dressing becomes wet or soiled, replace it promptly with a dry one to maintain a proper seal and reduce the risk of infection. Regularly inspect the drainage for any changes in its amount, in color, or consistency, and document all these findings accordingly. Keep the dressing dry and monitor the drainage. These are crucial for effective chest tube management. Tip number 7, check tubing for kinks and dependent loops. Regularly inspect the chest tubing for kinks or twists that could cause obstruction in drainage. Ensure there are no dependent loops where fluid could collect and cause blockage. Properly position and secure the tubing to maintain a clear path for drainage and prevent any type of complications. Routine checks will help ensuring the chest tube functions effectively and the patient's condition remains stable. Tip number 8, keep the chest drainage system upright and below the tube insertion. Ensure the chest tube drainage system remains upright and positioned below the level of tube insertion site. This helps prevent backflow and maintains a proper drainage. Regularly check the tubing for any clots or debris that could obstruct the flow. Address any blockages immediately to ensure optimal functioning of chest tube and effective patient care. Tip number 9, monitor water seal fluctuations. Observe the water seal chamber for fluctuations with the patient's inspiration and expiration. Normal fluctuations or tidling indicates that the chest tube is functioning properly and lungs is re-expanding. Absence of fluctuation may suggest a blockage or that the lungs has re-expanded. Report any significant changes to healthcare provider for further evaluation and interventions. Tip number 10. Watch for bubbling in dry suction system. Look for gentle, intermittent bubbling in water seal chamber. This shows the dry suction system is working well. If the bubbling is constant or missing, it might indicate a problem. Regular checks help ensure the system is operating correctly. Tip number 11. Document everything. Make sure to document all the relevant observations, including the amount and type of drainage, the condition of insertion site, and any changes in the patient status. Accurate documentation ensures continuity of care and provides valuable information for ongoing treatment and evaluation. Remember, careful monitoring and documentation are key to providing effective patient care. If you found this video helpful, please like and subscribe for more essential nursing tips and updates. Thanks for watching.